Good afternoon, everyone, and thank you for joining us today. Since the media availability yesterday, we have no new cases of COVID-19 in our province. The total number remains at 259. We have 241 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador Grenville Health. 53% of cases in our province are female and 47% are male. By age, we have 22 people under the age of 20, 38 between 20 and 39, 39 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 4 people are in hospital due to the virus, and 2 are in intensive care. 241 people have now recovered, and in total we have tested 9,139 people. While another day with no new cases is definitely a promising step in the right direction, we will be closely monitoring this week and the next for any potential fallout as people begin to double their bubbles. I cannot stress to you enough that strictly following the orders at every alert level moving forward will be critical to our success, and I thank you in advance for your patience, understanding, and cooperation. As we navigate the next few weeks and months, we must remain steadfast in our efforts to protect our families and our vulnerable populations. The risk of COVID-19 is still very real in our communities, and we need to be extra vigilant to help mitigate this threat. The public health measures we have so diligently practiced are now embedded in our daily routines and must continue for the duration of this pandemic. This includes keeping a safe physical distance from others in public spaces, washing your hands often and well, covering coughs and sneezes, and staying at home as much as possible, and especially when you're feeling unwell. These measures will remain our best defense and will help prevent future outbreaks of COVID-19. I would like to acknowledge today the stress and worry prevalent right now among our business community. Business owners and leaders have expressed concern for their staff, the economic impact of COVID-19 on our province, and about what will be required of them as we move forward to Alert Level 4 in the coming days. We know your main priority right now is to reopen safely for the staff and public, and we will work with you to support you in doing so. I am mindful that every measure we introduce will have consequences beyond the control of COVID-19. This pandemic has been about balancing the benefits of these measures with the risks. I was happy to meet with the business community this morning to help inform the path ahead and look forward to working with them in the future. We have laid a solid foundation for moving ahead with COVID-19, and as we navigate the next level, I hope you will find peace and comfort in knowing how far we have already come thanks to our collective efforts, support, and determination. The path ahead may not always be easy, but together we will see this through. Tough times never last, but strong and resilient people do. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald, for today's update. I guess now sitting at day number 4 of reporting what is no new cases of COVID-19 in Newfoundland and Labrador. I will say that we've seen in the news lately, and disappointed to hear that over the weekend, approximately some 90 staff members of Eastern Health came into contact with a patient who had previously tested positive for COVID-19. So, as Dr. Fitzgerald has said, the staff members are following, like everyone else, are following the health guidelines at this very moment, and they are self-isolating for the next 14 days, and their symptoms are being monitored. They have been all tested, and none of them has come back to be positive. So that is good news. So the steps that these 90 people are currently taking is important, is precautionary measure on behalf of Eastern Health. So our message to these essential workers who are self-isolating at this time is we want to thank them for what they've done and what they will continue to do. It's those essential workers that we cannot say thank you enough. You have been the front lines and supporting the people of this province for many years, and you're doing so in what is one of the most darkest moments in terms of healthcare. And certainly in this pandemic time, it's the unknown that can create and add to that stress. Now it's time for you to take care of yourself and do what is necessary to protect yourself, your coworkers, and your family. So we indeed are thinking about you. We do know that the additional stress that this has caused can be challenging, both in your careers, your family, who are, I'm sure, thinking about you as we are. Please know that we will continue to be with you to support you. You have supported us as a population for many years, and we will now support you at this time.